So we're looking at page, what page are we on here? 110 under platelets. This is the last of the big three of the whole parts. Talk about red blood cells, white blood cells. I need a better marker. And I'm going to go get one if I don't have one, so it shows that better on screen. If you'll bear with me for a minute. Oh, we're good, we're good. Okay, these are created in the bone marrow. That sounds like it might be an important piece of information to me. Where are red blood cells and all your blood cells created? In the bone marrow. 1,000 points to the person that can tell me the H word that means formation of blood cells. Hematopoiesis.
Yeah, I know it, but I can't say it.
Valiant effort, but okay. Although they are called thrombocytes, I'm not even going to write that up here. You guys, I've told you, got to remember that word. I'm not going to do any more. Platelets are actually cells, but they're membrane. They're not actually cells because after they form, they lose their nucleus. That's not really important for you. We're still going to call them cells. They still have site at the end of their official names. But they're for clotting. Every 1 microliter of blood contains about 200,000. And you remember white blood cells, we had about 11,000 on average in people. And red blood cells, we had about 5 to 6 million per microliter. So some very defined numbers. You shouldn't be getting real confused when you're like, oh, white blood cells, red blood cells. Million, 11,000, 200,000. Okay, which would you rather have, $11,000, $200,000, or $5 to $6 million? Million thousand is not a thing. Platelets, they return to circulation, or they live for about 9 to 12 days, but I don't care about that one as much as I do the 120 days for red blood cell. And we've already talked about hemostasis. And so that pretty much wraps up chapter 7. I think you all I feel good about your antibody questions and your antigens. We've looked over that enough. I will tell you for this, you need to make sure you can understand, actually I might just do that separate, about innate and immune on page 115. I'll cover that with you either in class or as something separate you can go watch. Just in case you see a test question. All right, now looking at chapter 8, we have looked at pages 130 and 131 128 through 131 many times. You all should have been in there a bunch. Yesterday we really started on 127, and I'll give you a chance to find that page in your book. Okay, if you look at the left side of it, I know I'm going backwards in the chapter, but please forgive me. If you look at the left side where it has whole blood plasma and serum in blue, does everybody see that?
On which page?
127?
Yeah.
Okay, so that describes everything. Remember, I've drew this picture up here a million times and talked about how you separate it, and then plasma minus clotting factors equals serum, and here's the whole parts, and then this is 90% water. That picture I've drawn and told you about those components and how they're separated. That's what is written in these paragraphs. Okay. So you should read that and you should be like, oh yeah, I remember him talking about that. I'm familiar with this stuff. Okay, that's going to be on you to read that. But remember, I told you this right side of this page is really important for the whole course. If you don't know what's on this in these few paragraphs on the right side, and then where it talks about glycolysis and clot activators and polymer gel on the other side, Then this is the second most important part of the book, where it says, and all the stuff I've been telling you up here. The first thing I ever asked you to remember and repeat after. On 123, I paid a close-up of a needle and the lumen and the bevel and the point. And then on the right side, I see some sizes and gauges. And those colors, they may not be for every needle you ever pick up. Different manufacturers choose different things, but they try to stick with it. You should be picking up a needle, seeing what gauge it is before you put it in the patient, if you're not for sure. Like there's black and green in there, until you're familiar with it. And so I'm going to call out to you a few important things and things you need for certification for my test over the beginning of chapter 8, and then we'll get it out of there. So let's go look at the first part, 119 and 120. I'm looking at page 120, phlebotomy equipment. Okay, organizing and transporting, I'm sorry, at the bottom. Phlebotomists use a portable tray to carry all necessary equipment, like the one I got right there. Like a carpenter's toolbox, the tray is compact, efficient, and it helps you carry stuff. You know that. You got purses, right? You are responsible for making sure that your tray is well stocked and clean and organized. You should empty it and disinfect it with bleach solution. How often?
Once a week.
Yeah. Equipment, chapter 8, page 1. Clean and disinfect at least times 1 weekly. When you get to Rock Castle, if you start working there, they might have every 3 days. And you're going to have to initial it, you disinfected it. But that's at least a good starting point. If I was a nice phlebotomist, I would wipe it down as best I could before I even set it up for the day, At least cut the handle off. I may not take every little thing out of there. What do we use to clean? So that was important information for a test question. Here's another one. Use 10% bleach solution. That's like sort of the gold standard for cleaning surface tops. Now, hospitals have these things, and they might even have Lysol. This one's specifically for bleach. It's got bleach in it, and there'll even be tubs that look just like this, but might be pink on top, and they're like virucidal type stuff. Don't get confused by any of that. Okay, in this world, in this book, if you need to clean it and you don't have something already pre-approved, you use a 10% bleach solution, which means you take a jar and you fill it up with 1 part bleach, right? Right? And 9 parts what? Water. Which would be 10% of this this jar is bleach. It's a 10% bleach solution. That may seem obvious, but it's not so obvious to people. All right, moving on here. You're going to encounter patients. I'm looking at page 121, top left. 2 primary settings. One could be at an outpatient clinic. So in the hospital here in Somerset, the lab department, you walk in on the first floor and you snake your way through there's like a big trophy case there. They've got like a huge waiting room of people just waiting to get labs. And like a window you go check in at, and when you walk back, it's just a bunch of chairs, and you might sit in there and just stand there all day, and patients come to you, and you're drawing and sending them on. What's the other scenario? Yeah, you're up, and you're going from floor to floor and from room to room, and you're going to your patients. All right, so you might have multiple stops along your path. Why do you think that's pertinent when we're talking about cleaning our equipment and stuff?
Because isn't it every time you leave one room, you have to clean your equipment before you go back into another room?
Well, ideally, you wouldn't take your equipment into the room.
Well,
It would stay in the hallway.
Right, yeah, you leave your part in the hallway.
And I don't even know if you'd take that. You might. You might be good enough where you can put it in your pocket and know exactly what you got everywhere, but Yeah, so you're gonna have a big cart with a lot of supplies on it, and you're gonna take your thing off of that cart into the patient's room. You're not gonna push the whole cart into the room because then the whole cart is potentially contaminated. And then not only is it contaminated, if it is, you're gonna take whatever it's contaminated with to the next patient's room and be a source of infection.
Be spreading infection everywhere.
All right, so a wheeled cart is sometimes used to transport large quantities of supplies. You're scheduled to collect samples from many patients, but the cart should remain in the hospital hallway. Bring one tray into the room. One patient's room does not, once in the room, do not place your tray on the patient's bed where it could easily be overturned. Okay, so you're in the room. You're in your bed. And yeah.
No.
If they're conscious enough, I might put it there. I mean,
What if they kicked it? And it,
no, I mean, if it's like an old guy, he's like, oh yeah, I know you're here. Hey, how you doing? So I can set this here. Place the tray on a flat, solid surface, such as a chair or empty rolling tray. All right. To prevent contamination, the bottom or sides of your tray, avoid any areas that contain the patient's personal effects, and avoid the patient's bedside table. Okay, so now it's not a matter of turning over, it's a matter of this touching their personal effects, and I would consider their blankets personal effects, right? And so this bedside table that they're eating on, and their books are on, their glasses, their water cups, probably their urinals for a lot of people, you don't want to be doing that. So where do you set this thing?
In the floor.
It's just right here. And you're like, in chair. For you all of you at home, I said you got to bounce it on your head. Well, let's read here. Keep extra supplies within reach. However, you may need them during a draw, for instance. You may need to replace a tube while a needle is still in the patient's arm, which can happen. Sometimes the vacuum's lost, right? Always take an extra tube in there. You'll do that mistake one time and then you'll learn. Okay, outpatients, on the other hand, come to you. Talks about the chair, yada, yada, yada. You want to wipe down your chair and follow your facility protocols after every one. Tourniquets. What can tourniquets be made of sometimes, other than rubber? That's potentially allergic to people. What was the number? Latex. Okay, so you got to make sure you're not using latex. If you are, you got to make sure your patient's not allergic to latex. You all remember that, anaphylactic shock and stuff. But most common, they're not going to be. They'll be one-time use disposal. And ours are one-time use disposal. Don't throw them away after every time. Okay. Oh man, there's a good word on the top of 122. We haven't looked at that in a while. Do you mind reading for me, Demi, the CLSI, that first couple sentences there?
Where?
Top of 122.
Oh.
It starts on, you can just read from used in some facilities, clinical and lab standards.
Clinical and laboratory standards, institute standards indicate that once a tourniquet has been used, it should be disposed of to reduce the risk of pathogen transmission between patients, including skin pathogens such as methicillin-resistant staphylococcus, whatever.
You said that all correct, Arius. MRSA.
Yeah. Do you want me to keep going?
No. Just remember, these are the guys that make all the rules for you. And you'll see the acronym. According to this institution, if you see a test question, you should kind of be familiar with that. A lot of acronyms in this class. You can use a blood pressure cuff. All right, important part. Everybody perk up and listen to this. So after that, I'm looking at page 122, and now we're looking at cleaning the puncture site. 122, cleaning the puncture site. Antiseptics and disinfectants. What's the difference between an antiseptic? Read it there for me, someone.
Antiseptics and disinfectants are used to reduce the risk of infection. By convention, antiseptic refers to an agent used to clean living tissue. Disinfectant refers to an agent used to clean a surface other than living tissue.
Yeah, so this is your countertops, equipment, and then this is living tissue. If you get confused, Just think about the words. What happens when you become septic? You get real sick. And if you do something against it, like if you're trying to prevent it or you're an antiseptic person, you're not for people becoming septic, you clean your skin off before you stick them properly. If you're wanting to keep people from getting infected from your equipment, you're going to use a disinfectant on it. All right? Don't use these to clean your patient. You see baby wipes or bleach wipes at home. Right there it says, not a baby wipe with a baby and a big red thing through it. Okay? Don't use a disinfectant on a baby, on living tissue.
Whenever I was in the salon, there was a woman that would come in and get a haircut, and she would try to use the barbicide wipes every single time to wipe her hands. And barbicide, you're supposed to wear gloves to handle. It's a very heavy disinfectant.
Yeah.
This woman,
I've always been
time
curious
she would
about
go
it,
for-
honestly.
Huh?
I've always been curious about it because, like, I'm in this field and I just see a thing, a vat of combs. I'm like, what really is that?
Yeah, no, you're supposed to wear gloves to handle barbicide. Nobody ever does, especially the wipes. The wipes are really concentrated. But there was this woman, every single time she would go for those barbicide wipes, and I'm like, girl, you don't want to do that.
Well, in the field, like if I'm doing dentistry in the field, we can do liquid sterilization where if you leave the stuff in the liquid submerged for long enough, it will be considered sterile. If you can't have like electricity and an autoclave and all that stuff.
I prefer an
So
autoclave.
barbicide's probably right in there. I'm curious about that. I'm going to see if I can go get something from Paul about it.
We had
They got the
to have
UV
a
lights
certificate
now
for
that they
it.
keep stuff underneath. I'm just wondering how effective those are. Okay, so when we're looking at people's tissue, let's look at the kinds of antiseptics we need. So what's the most common right now that you all have used to disinfect somebody's skin before you stick? Yeah. I'm going to read that for me, and antiseptic prevents there for you.
Me?
Yeah, just that.
And antiseptic prevents sepsis or infection. Do you want me to stop there, or do you want me to keep it?
I'm trying to read about like chemicals. It's kind of hard to concentrate with you two.
Oh, sorry.
Right here, carrying on.
Do you want me to keep
Get
going?
my nerves. Please start over.
Okay, an antiseptic prevents sepsis or infection. Antiseptics are used to clean the patient's skin before routine venipuncture collection to prevent contamination by normal skin bacteria. Antiseptics are distinguished from disinfectants such as bleach, which are used on non-living objects. The most commonly used antiseptic is 70% isopropyl alcohol.
That's it. Just stop right there. Isopropyl
Alcohol.
alcohol. That's what's in the wipes. If you were to pick up a wipe right here, it would say 70%. Keep that as a souvenir. All right. Now, the alcohol, it does not kill bacteria. It only kind of stuns it. Actually, it prevents, back to science class from high school, a bacteria will experience fusion and go bloop and become 2. And then those will become 4. And then they will split again, right? That's how bacteria works. They exponentially double. It stops that doubling for a minute. Okay, it's called a bacteriostatic. Bacteriostatic. Makes bacteria static. Inhibits growth or reproduction. For maximal effectiveness, the antiseptic should be left in contact with skin 30 to 60 seconds. You do not fan or blow on the site to speed drying. There's none of this. There's none of this before you give a shot or you get stick. Right? Even though we all do it, and it's very common practice. Okay, other antiseptics are often used for blood cultures and arterial punctures. Now we're talking about something a little more serious, right? We know about bacterial cultures. So let's read right there for a second. Keep going for me there, Aaron. That second paragraph.
Other antiseptics are often used for blood cultures or arterial punctures. Povidone iodine solution, betadine, is sometimes used. However, iodine interferes with some chemistry test results and cannot be used routinely. Chlorhexidine?
Okay, pause right there.
Okay, yeah, 'cause I was like, I think that's how you say that.
All right, that can be used to sterilize skin or betadine. Everybody knows, you've seen surgery on TV or something, they're painting them orange.
Yep.
That's what that is. But that povidone iodine messes with some of our chemistry. I think it's calcium in there, actually. It kind of messes with somehow. And calcium's important for us in a lot of our tests, right? We know that. And so sometimes we got another one. Now you can read the next one.
Chlorhexidine gluconate.
Okay, right there. Is it chlora?
CHLORHE.
Yeah, hexidine. And then the brand name of that, just like this one's betadine, is Chlorohex, if I'm not mistaken.
It says that or, and then it says like benzocaneum.
Yep, we're coming to that one too.
I feel you, girl.
Benzocaneum chloride is Zephyrin chloride is available and is used for blood cultures and for patients sensitive to
Yeah.
iodine.
People have iodine allergies, shellfish, they can't get the contrast. And so in that case, you would use, if you can't go to the iodine because of allergies or whatever, you're going to go with this one. I'll be out of your way in a second. Sterilize skin. But this one has a big, I consider it a big caveat. And the last sentence in that paragraph she did not read is you can't use that on children younger than 2 months because their skin will absorb it and it could hurt their liver. And if that's the case, you would go back to here or soap and water. All right. Important test question we'll come back to. If I'm in the ER and they're saying draw blood on this dude, we think he's been drinking, he's been in a car accident. Which one of these will you not use? Yeah. Okay. So there you go. And then, or you can use soap and water. According to your book. We'll come back to that. All right, good. So now you've learned about all your antiseptics. Not only do you know how to access the vein and the tubes, now you know the chemicals you're cleaning your skin with and why you use them. You should feel professional. Protecting the puncture site. Yada, 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 2-inch clean gauze, sterile gauze. Use of cotton balls instead of gauze is not recommended. Well, sorry. Has anybody in here died from me using cotton balls to?
No.
Okay.
I just don't like cotton balls.
Blood came up where a clot was in her finger and I popped it. I used the wrong finger first of all. I should have used a different finger, but I didn't know. I couldn't remember, or the previous nurse charted it wrong. We don't really chart which finger you use, but so oftentimes she's like, no, I want you to use this one. So I just went, yeah, sure, pop. Now, should I put in the book that I should wear glasses every time I go in to do a blood sugar stick? I don't think so, and that's what I think's happened with the cotton balls there. That was a long point to make for that, but it's a good story.
Are you supposed to pour
What did you
alcohol in
do?
your
What was your
eyeball?
reaction? Like, what did you just stand there? Did you wipe your eye? What did you do?
I went,
Because I wouldn't. know
okay,
how
you're
to do
good.
that.
I quit. No, I just went and washed it out, washed it with soap and water. I should have probably reported it, but. Oh, my God. All right, I feel good about this chapter. Any questions? Okay, take 5 to 10.